In this video, I will go over different forms of hypersensitivity reactions. So there are 4 types of reaction: type 1, type 2, type 3, and type 4. And the first 3 are all immunoglobulin mediated. And then the 4th type is the T-cell mediated, and that's why it's a delayed reaction. Now in the first form, there are IgE antibodies that are on the surface of mast cells, and once these IgE antibodies interact with the antigens, they induce the release of histamine, which can cause the allergic reaction, asthma, as well as the anaphylaxis reaction. And common causes of anaphylaxis reaction include foods like peanuts or the bee sting. So let me draw this process for you. So if you have a mast cell which has the IgE receptors, and if an antigen cross-links these IgE receptors to each other, it causes the degranulation of the mast cells, so the histamine will be released and cause the allergic reaction. So the memory aid that you can use to remember all these reactions is that type 1 is associated with allergic, asthma, and anaphylaxis reaction, and A is the first alphabetic letter. So the type 1 hypersensitivity reaction causes allergy, asthma, and anaphylaxis. The second and the third type are mediated by the IgG or IgM antibodies. So in the second type, it can be divided into cytotoxic or non-cytotoxic subtypes. And in both forms, there are antibodies that are formed against the cell surface antigens. So the IgG and IgM antibodies are capable of activating the classic pathway. And in the cytotoxic hypersensitivity reaction, there is a complement activation, while in the non-cytotoxic type, there is no complement activation. And the examples of cytotoxic hypersensitivity include the good Pasteur syndrome, rheumatoid fever, as well as the hemolytic disease of the newborn. So in patients with good Pasteur, there are antibodies that are formed against the kidney basement membrane. In rheumatic fever, antibodies that are made against the group A streptococcus will interact with the heart valves. And then finally, in hemolytic disease of the newborn, if there is a mother that is Rh negative, and then her child is Rh positive, her body will start to make IgG antibodies against the Rh antigen. And since IgG is capable of crossing placenta, it will cause hemolysis of the fetus blood. And this is referred to as hemolytic disease of the newborn. With the non-cytotoxic type, there is no complement activation. And examples include the myasthenia gravis, Graves' disease, as well as type 2 diabetes mellitus. So again, you know how with the second hypersensitivity reactions, there are antibodies that are made against the antigens on the cell surface. So with the Graves' disease, there are thyroid stimulating immunoglobulins that will stimulate the thyroid cells to increase the thyroid production of the T3 and T4. With the myasthenia gravis, there are antibodies that are formed against the nicotinic acetylcholine receptors, and these receptors are required for muscle activation. So therefore, patients with myasthenia gravis will feel weakness because there are antibodies against nicotinic acetylcholine receptors. And finally, type 2 diabetes mellitus can be caused by type 2 hypersensitivity reaction, and in these patients there are antibodies that are formed against the insulin receptors, and thus there would be decreased sensitivity to the insulin. Type 3 hypersensitivity reaction is caused by the formation of the antigen antibody complexes. So if there is an antigen and then an antibody is formed against it, whether it's an IgG or IgM, this whole complex can cause complement fixation and the release of cytokines, which leads to the destruction of the nearby structures. And common conditions that are caused by type 3 hypersensitivity reactions include SLE and rheumatoid arthritis. So in both conditions, the joints will be destroyed because of the reaction mediated by the immune complexes. Other examples include the Artus reaction, where the antigen-antibody complexes deposit in the walls of the small blood vessels and cause skin necrosis. And finally, we have the serum reaction. An example of serum reaction is when antivenom is made by injecting the venom to either the sheep or horse so that these animals will start to make antibody against the venom. And then later on, the antibody will be extracted and used as an antivenom in humans. So if this is the venom, and then the sheep or horse makes antibody against this antibody is used as an antivenom in humans. But then humans can perceive this antibody as an antigen itself, so they would make their own antibody. So this is human antibody against the sheep or horse antibody. So this would be another antigen-antibody complex that would be formed in the serum reaction. And this is a type 3 hypersensitivity reaction that causes fever and polyarthritis. So let's go back to the top. So example of type 3 hypersensitivity reactions include SLE, rheumatoid arthritis, Arthus reaction, as well as the serum sickness. And finally, we have the type 4 hypersensitivity reaction, which is delayed and is T-cell mediated. So in these patients, it takes about 48 hours for the symptoms to manifest. An example of type 4 hypersensitivity reaction include the tuberculin PPD skin test. So if you've noticed, you're asked to return 48 hours after the skin test to check if there is any reaction. And then another example is the contact dermatitis, which is caused by either poison ivy or nickel. And then about 48 hours after exposure to either one of these patients usually present with the rash on the skin. And then finally, acute graft rejection as well as graft versus host disease are other forms of type 4 hypersensitivity reaction. So let me go over that again. So we have 4 types of graft reaction: the hyperacute, acute, chronic, as well as graft versus host disease. So in the hyperacute, there are preformed antibodies which will cause the rejection of the transplant in a matter of minutes. In acute form, which is T-cell mediated, it takes a few days for the T-cells to destroy the transplant. So this is T-cell mediated and can take days to weeks. With chronic, there is fibrosis of the blood vessels of the graft, which will eventually cause the necrosis of the graft tissue. And this usually takes months to years. And then finally, in graft versus host disease, the donor bone marrow will start to make T cells against the host cells. And thus, this is also another T cell mediated reaction. So just keep that in mind. Acute transplant rejection as well as graft versus host disease are also T-cell mediated. And the other example of T-cell mediated included the PPD skin test as well as contact dermatitis, which are commonly caused by poison ivy and nickel, and it takes about 48 hours for the symptoms to manifest. And that concludes our discussion.